Hi and welcome. You are watching The Island Docs. I am Dr. Sandy and this is my co-host, Dr. Gordon, and we are here to talk all things health and health related. Today our topic is viruses. And a virus is a small infectious agent that lives inside of a living organism. And the three viruses that we're going to discuss today are the chikungunya virus, which you've probably heard about in the news that is happening now in the Caribbean and in the US, dengue virus, and then also the Ebola virus. So the Ebola virus is the most, life-threatening. It has a high mortality rate of about 89%, and it is one of the 30 viruses that is actually a viral hemorrhagic, that causes a viral hemorrhagic fever.
Yeah, what is hemorrhagic fever?
A hemorrhagic fever is basically when you have a fever of about 40 degrees and it is combined with bleeding. Hemorrhagic means bleeding.
Okay, so Ebola virus is one of those that causes a fever with their viral infection and bleeding.
Definitely. And it is spread by direct contact with body fluids. Now, you can either get primary exposure or secondary exposure.
What do you mean by primary exposure? What is that?
Like primary exposure is like when you're exposed to a place that has Ebola virus, while secondary exposure is when you come in contact with a direct person. So let's say areas like Sudan, Zaire, all these places that have effective cases of Ebola virus, if you go there, then you are having primary exposure because you're in the location. But if someone comes from there to visit and you come in direct contact with them, then you're having secondary contacts.
What's the major difference between a primary and secondary exposure?
Well, it definitely has to do with the incubation period. And the primary incubation period is a lot shorter than the secondary incubation period. And that would mean that the primary is a little bit more aggressive than the secondary.
Right, so the Ebola virus, how is it spread? Tell us, how is it spread?
By direct fluid contact.
Okay, so once you have contact with someone who has the Ebola virus, you need to stay away from bodily fluids, saliva, feces, anything that came out of their body that may be infected in a fluid sweat. Those are the kind of things that you need to avoid if you have to interact with somebody with the Ebola virus.
There is a lot that we still don't know about the Ebola virus. It has actually been shown recently to also be passed after death because of the practices of washing the body. So even touching the body days later can put you at risk. The recommendations of the World Health Organization is that when you are paying respect, you need to do it from at least 1 meter away without touching the body. Most people who would be interacting with somebody who has the Ebola virus are the healthcare workers, or if you go to the areas where they are endemic, or if someone comes from that area and then comes to your country.
And some of the other signs of symptoms of this Ebola virus, it runs the entire gamut of headache, fever, rash, arthralgia, nausea, vomiting, diarrhea. You name it, the entire gamut of just malaise, not feeling well.
Bilateral conjunctivitis, where both of your eyes are red. You have injectional conjunctivitis as well. Some of the later signs that you probably will see are, having an expressionless face, myocarditis, that's an infection of your heart. So you might get some chest pain, pulmonary edema, you might have some shortness of breath.
Yes, because pulmonary edema is when you have fluid in your lungs.
Yes.
So Ebola can also cause pulmonary edema. Even going further, just before the Ebola causes the most damage, which is close to death, you have tachycardia.
Tachypnea.
Tachycardia just means your heart is beating fast. Tachypnea, you're breathing fast.
Very quickly.
Hypotension, which is a drop in your blood pressure.
Definitely.
And coma.
Yes.
And death. So Ebola is a very, very serious virus.
Yes, it has a high mortality rate of about 89%. It has actually shown that there have been 1,300 cases of the Ebola virus, and the CDC estimates that without changes, these numbers can eventually soar to the millions. Recently, the CDC had a sit-down and met to discuss the increased funding to the development of new vaccines and the training of new personnel to ensure that these numbers no longer exponentially grow.
And the sad thing about this Ebola virus is that there
have
is
any
no treatment. So unfortunately, this is one of those things that the best thing is prevention is better than cure. You need to just avoid going to areas where there's a high Ebola outbreak, or as a healthcare worker, take very, very careful special precautions when dealing or handling anybody with Ebola virus.
Yes. There have been known cases in Sudan, Zaire, Ivory Coast, and Nigeria. And because nowadays you know that people are traveling more internationally, it doesn't mean that if you live in the Caribbean or in the US that you may not be exposed to the Ebola virus.
Exactly. And I mean, even if you are exposed, so you've been in contact with somebody who's had the Ebola virus and then you start feeling generally unwell. For the Caribbean people, what I need for you to do is to present yourself to the healthcare provider as soon as possible and let them and relay this information that you have been exposed to somebody with the Ebola virus so they can start making the necessary precaution, because you would need to be in some type of isolation so we are not interacting with the general public, as well as your healthcare workers need to be aware that they are possibly dealing with an Ebola case, which case they need to make special arrangement where their hazmat suits, where they wear special masks, special gowning, take special precaution in dealing with your body fluids. So this is the information that we would like to let you know, that if you are exposed to somebody with the Ebola virus, then you need to go to your healthcare workers and tell us early.
It's important to know about Ebola virus because there is no known treatment and no known vaccination that is proven effective. We're going to take a break now, but when we come back, we're going to talk about dengue virus, which is another virus out there that is spread by the mosquito.